our last case of the day. We are doing a tummy tuck. We are doing a BBL.
Seems to me you need to do this, and we're getting a lot of this.
And we are doing lipo 360.
One guy just kept having it.
Thanks for joining us.
Anyway.
We are also live on our YouTube as well. If you guys want to hop on over there at Dr. Jeneby Plastic Surgery. Over there, we like to show the surgeons. We can show the surgeons, we can show our patient, we can show the operation. So if that's something that interests you, you can join us over there. And we are just getting started on our last case of the day. So we are with Dr. Boom Boom Pow. We're also going live on Dr. Bam's account. However, he's not with us right now. He will be joining us later on. But we just want to give some of his followers the opportunity to hop on and join us and ask any questions if they had any. So if y'all have any questions, go ahead and comment those down below. Be happy to answer those for you, or we can have Dr. J answer those for you as well until Dr. Bam gets here. Again, we're getting started on our last case of the day. We are doing a BBL lipo 360 and a tummy tuck. So we're getting started on some lipo right now. We have Dr. Boom Boom Pow doing some lipo on our patient. So we always start off, if there's something, if there's part of our patient's surgery that is happening on the backside, we always get started on the backside first before we do the front. So right now we have our patient lying on her stomach, and Dr. Boom Boom Pow is doing some lipo 360, so on her sides and around her back, so like where love handles are, things like that. That's where we're doing lipo first, and towards the upper back as well, so close to like the shoulders, sort of. And then we're going to go in and do the BBL. So once we get enough fat, we are going to go in and inject that into our patient's butt for the butt lift. Hey there, Alex, on our YouTube. Hope you're having a great day. And again, for those of you who are live with us here on TikTok, we are also live on YouTube. On our YouTube, we like to, well, on our YouTube, we can show this, the surgery itself. We can show our surgeons. We can show more things that are graphic over there that would otherwise be flagged over here on TikTok and Instagram. So if you guys are interested in seeing the surgery itself, you guys can join us over there.
My kid contracted hand, foot, and mouth on last Saturday.
Hey Alex, do you perform fat injections in the sensitive area for men in the clinic? Great question. So we do offer fat grafting. If that's what you're asking about, that is something that we offer. It's something Dr. Boom Boom Pow is really experienced in doing. It's not as common. It's a less common procedure, but we do offer it, so yes. If you're interested in booking a consultation, you can visit our website at Dr. Jeneby Plastic Surgery, and you can get a quote there if that's something you're interested in. And again, for those of you joining us, we're on our last case of the day. We are doing a BBL lipo 360 and a tummy tuck today. So we're just getting started on some lipo.
Anyway.
And then we'll go in with the BBL.
I bet you a lot of kids were at home.
Hello.
Already.
Yeah, Alex, hope that answers your question. And if you have any more, we'll be live for a little while, so
July 4th now?
feel free to comment any more that you may have.
My wife went to Korea with her sister who so they're out there all this week.
Oh, okay, perfect, man.
Yeah.
Just be by yourself, maybe even go catch F1.
Yeah, that's what I plan on doing, exactly that.
Just go enjoy the solitude of a movie by yourself.
Hey everybody on our YouTube and over there on Dr. Bam's TikTok. Hope you all are having a great day. We are doing a tummy tuck, lipo 360, a BBL. Any questions about those services or any other services that we offer here at Chrysalis or something that our surgeons offer, feel free to comment down below. Be happy to answer those for you, or we will have, we can ask one of our surgeons. So we have Dr. J with us right now. Dr. Phillips will join us shortly. I just like to go live on his platforms just to give his followers an opportunity to inquire and ask some questions.
Somehow, some way, I strike up conversation. I learn a lot.
Hey Norma, they're on our YouTube. Good morning. Which procedure to do first, the tummy tuck or the BBL? Yeah, great question actually. So, interestingly enough, whenever we have a case that has multiple surgeries all in one, and we have procedures being done to the front of the body, so like the breast, tummy, things like that, or things being done to the back, like lipo, but we always start with the back first. We always do the BBL before a breast lift or the BBL before a tummy tuck. Great question. And that's just to prevent the areas in the front are a lot more sensitive, and like if you get your breasts done before the BBL and they have to turn you over after they've just put like implants in, they're likely to obviously have problems right after. They're not given time to really heal. It's just a lot of pressure being put onto them if you think about it. And so, but like for the butt, it's also not great to have a lot of pressure on those areas either. But through practice and following after other surgeons, I mean, there's been a lot of people before us that have kind of figured this out for themselves. We just find that it's, when people do back-to-back surgeries, it's better to do the BBL first, because it's not as, the effects of it, putting pressure on the butt instead of the breast are not as great as, or not as bad as when you put too much pressure on the breast right after you do them. So I hope that answers your question there, Norma. And again, for those of you just joining us, we are doing our last case of the day. So we are doing a BBL, we are doing a tummy tuck, and we are doing a lipo 360. So right now we're just getting started with some lipo. Of course, we have to do any kind of lipo before we do a BBL, because a BBL is a butt lift, and so we add fat to it. That's the only way that we can do like a butt lift. So we always start with some lipo. Right now, Dr. Boom Boom Pow is going in, and he has his little tool right now. It helps to kind of loosen that fat, if you will, so that it kind of gets suction better. And then he's going to go in and extract it. So right now he's just kind of making it, I don't want to be gross, but kind of making it slushy-like. And then he'll go in and just suck it right out. And then from there we collect it, we hold on to it, and then we add it back into our patient's butt.
You don't know, man. Wait till I grow up.
I hope he said, Dad, I want to be a golfer. I'll be like, yes.
Yeah, now we're talking, homeboy. Man, I did not realize how much those suckers make.
Oh, yeah.
Even if they don't win, next time they're bringing home 9 and 7.
Hello again, for those of you just joining us, we are doing lipo 360. We are also doing a tummy tuck. We are doing a BBL. If you guys have any questions about that, those services or other services that we offer here at Chrysalis or Maximus Surgery Center, go ahead and comment those down below. I will be live here for a little while. You guys can ask any questions, comments, concerns, anything, you name it. We also have Dr. Boom Boom Pow in front. So if you guys would like to ask him a question as well, or if there's something I can't answer, then feel free to ask away and we'll have one of our surgeons answer. We also are open to taking DMs, so if you guys just want to go ahead and private message us, feel free to do that also. And then we also have forms here pinned on the bottom of the screen. Once you hit it and fill it out, somebody from our team will reach out to you. And so it kind of gives you another opportunity to ask questions, inquire further. If it's about our surgeon, if it's about the procedure, if it's about whatever, like, you're at the liberty to do so, but you have to fill it out first. So it takes about 1 minute, less than, and once you're done and submit it, it's done, and somebody from our team will just reach out to you. So again, it's going to be pinned here on the bottom. It takes 1 minute. It's going to help you figure out financing, consultations, booking, pre-op, post-op, all those things. So consider that. Again, we are on our last case of the day. For our last case, we are doing a BBL, we're doing lipo 360, and we are doing a tummy tuck. And so we always get started on the BBL portion first. So we are doing lipo. So that is extracting the fats from our patient. We always start on the back. Since we're doing lipo 360, we're getting started on the back side. So going in, extracting that fat, we're going to collect it in this little container. If you're on our YouTube, you can see it. There's a little container that sits and it just collects all this fat that we extract, right? That we suck up with a tool. And with that, we hold on to it. Then we take all that fat, not all of it, but we take some of that fat and we go ahead and inject it into our patient's butt to give it a more full, desired look. So whatever we like to satisfy our patient's desire, so whatever they're going for, if it's big, if it's subtle, you name it. And sometimes people don't want like really a lot going on there. They just want a little fullness added, and that's great when we do we can do subtle BBLs, we can do bigger. It just kind of depends on what you desire, but of course we can do all of it. And
Left line?
Left upper back. How you doing, McKenna?
good.
Everybody doing good questions?
Yeah.
Awesome.
Hey there, Maria. What surgery is going on today? Yeah, great question. So we are doing a BBL today, lipo 360, and we are doing a tummy tuck. So this is our last case of the day. We got started about 15 minutes ago. Right now we have Dr. Boom Boom Pow doing some lipo, so around our patient's back before we go in and do the BBL. We always start on the back side, so if we're doing a BBL and somebody's also getting their breast done, we'll always go in and do the back side first instead of the front, because if we were to do the breast first and then go ahead and flip our patient over and do the butt, it would just be a lot of pressure on those sensitive areas. What is included in lipo 360? Great question. So lipo 360 is like a 360, right? So it's going to be lipo from the back side, lipo on your sides, lipo on your stomach, lipo on kind of like where your love handles are, your upper back, and areas like that. And of course, like, you'll have a consultation. You'll meet with our surgeon, and then right before surgery, they'll do markings in areas where you want lipo, just to kind of confirm. And you can add on areas as well. Like some people will get chin lipo, or they'll do lipo where like the anterior bra line and things like that. So it's pretty broad, but it's usually going to encompass and include the back, the stomach, and the sides. But great question. Go ahead and comment any more if you have any. And for those of you who are interested, we're live on our YouTube as well, so you guys can see the surgery happening. The camera is flipped, so it's showing our patient, showing our surgeon. Dr. Bam will join us shortly.
All of it on the left. Can you turn toward me, airplane? Whenever you get it.
But yeah, Maria, I hope that answers your question. Go ahead and ask any more if you'd like. We'll be live here for a little while. And so again, we're just getting started on some lipo. So that's just extracting some fat, and we're doing that on the areas of our patient's sides and her back. So our patient's laying face down on the table, so her stomach's resting on the table.
What is $25?
And so we're just getting that fat now, and then we'll collect it. We'll collect that fat in a little tub connected with the tool that we're using. And then we'll take some of that fat that we extract, and then we'll take it and inject it in areas of the butt that our patient wants to look more fuller, more lifted. If you guys have any questions about that, what that looks like, go ahead and comment those down below, or you can join us over there on our YouTube and see it for yourself. It's at Dr. Jeneby Plastic Surgery. We're live here with on Dr. Bam's TikTok. He's not with us currently. He'll be joining us shortly, but I just wanted to open up this time and give his followers an opportunity to ask any questions, to tune in. So please feel free to do so. He will be joining us shortly. Again, we're on our last case of the day, and we are doing a BBL, we are doing lipo 360, and we are doing a tummy tuck today. So, any comments, questions, or concerns, go ahead and comment those, leave those down below. You can reach out to us privately. Y'all are ready to take the next steps in booking your consultation and booking your surgery and meeting our surgeons here. We have a form pinned on the bottom of the screen here on our TikToks. Once you hit it and fill it out, somebody from our team will reach out to you, and they will provide you with all the information you need in taking the next steps and booking your consultation and booking your surgery, finding out post-op, pre-op, you name it. So definitely take advantage of it. It's really easy peasy. It takes 1 minute. If you guys have any questions about it, just let me know. Again, we're on our last case, our third case of the day. We had 2 prior to this one. We had a thigh lift earlier. We had a tummy tuck. For our second case, we had a thigh lift, tummy tuck, and a breast lift. We were live earlier for it. And then the one before that was a breast implant removal. We were not live for that one. For those of you who are with us earlier. So this is our second live of the day. And our last live of the day. So again, if you guys have any questions, go ahead and comment those down below. Be happy to answer those for you. We will be live later this week and next week as well. You guys can give us a follow, and then it notifies you anytime that we do end up going live. If that's something that interests you. You can check out some of our other surgeons here as well. So we have Dr. Bam here. Thanks for joining us over there on Dr. Bam. We also have Dr. Boom Boom Pow over here. And we have some other surgeons as well. We have Dr. Latin Heat. We have Dr. Rocket, who are all here on TikTok and on Instagram if you guys want to search up their names as well. We network with those surgeons. They operate here. We do some of their content as well, help them with some of their content. And they each have their own unique personality as well. As you'll see, once you start looking through their profiles and things like that, they're all a little different. They're all a little funny. They have their own sense of humor. You guys can check them out.
Upper back.
Hey, Haley, thank you over there on Dr. Boom Boom Pow. We appreciate the like. Again, hope y'all are having a good Wednesday. Again, we're on our last case of the day, our last live as well of the day. We'll be live later. We'll be live later this week. We'll be live later next week as well. And for those of you who like to watch surgeries and like to see the operations happening and would like to see the camera flipped, you guys can join us on YouTube. It's going to be at Dr. Jeneby Plastic Surgery. So we are still working on some lipo on our patient's sides and back before we go in for the BBL.
You doing anything over the 4th?
I went to a pool party at my house with my kid. Jennyby's here.
That's cool.
Something low key. Like to have a little
Oh yeah.
in the pool.
Again, we are open to questions, comments, concerns. Right now, we're just working on some lipo. Again, so we're just holding on to the fat that we do extract.
Go grab the kids. Hey, Art. We're ready.
Okay. All right, you guys, we will be back later. We're going to take a little break. We'll see y'all in a few. Thanks for joining us.